If you are someone that you are having pains in your legs while walking, the chances are that you might have peripheral arterial disease. Majority of the people having this disease that they are unaware of. Today we are going to dive into what peripheral disease is and what can we do naturally to possibly help the situation. The symptoms of peripheral arterial disease are normally pain in the buttock area, in the soft tissue knot, in the bones, in the back, or elsewhere in the bone, but particularly in the soft tissues, the front of the thigh, in the below the knee. When you are walking and if these pains are coming, but when you rest, the pain goes away, that is the symptom of the peripheral arterial disease or the blood vessels in the legs. The risk factors are diabetes, high blood pressure, high level of cholesterol. The most important one is smoking and of course age. As we age and these pains start to come upon walking, normally we blame it on the age, but in fact this is the peripheral arterial disease. Now what we can do to possibly overcome the situation to help alleviate the pain, the best thing to do is exercise. Leg exercise is the most crucial thing for peripheral arterial disease, because as we exercise the legs, the muscle pushes the blood vessel to create side branches, and these are called collateral circulations. And collateral circulation basically overcoming the demand of the blood, of the oxygen for the tissue downstream, and thus then we don't have these pain and aches. So a leg exercise is extremely important. We can also take some supplements like the good fish oil, 4,000 milligram, 2,000. You can split the dose, 2,000 in the morning, 2,000 at night. And similarly, flaxseed oil, 2,000 milligrams should be enough, and about 2,000 milligrams of curcumin, that's good for inflammation. Another thing that you should do is diet. Lifestyle change is extremely important, and adding a lot of green to your diet is also very important. The third supplement that is called rutin. It's a natural product, but it's a blood thinner, and it helps smooth the flow of blood downstream. So that is also helpful in this situation. So if you're having these pains in your legs, don't blame it on your age or any other comorbidities. These are simply could be the blockage in the blood vessels in the legs. A lot of physicians are not trained to diagnose these conditions. So you would have to find yourself a peripheral intervention cardiologist or a vascular surgeon who does these procedures, and they would do some testings, and after when they confirm that there is a disease in the blood vessels, then they can open these blockage with either a stent, or some interventionists can do a procedure called atherectomy. Atherectomy is basically a procedure to cut the plaques inside the blood vessels, and then they clean the lumen of the blood vessels, and then the blood flow remain smooth, and then you don't have those symptoms anymore. So the rule of thumb is to look for a peripheral intervention cardiologist or a vascular surgeon who can make these diagnoses if you happen to have these pains in your legs and your lower limb.